Well, the brain, it's one of my favorite organs. It's right up there with some of my other favorites, but maybe the best. Really, if our brain's not working right, everything becomes a hardship. There's a condition sometimes described as brain fog. It's not dementia. It's not a concussion. It's that state where the brain is a little sluggish. It's just not moving the way it normally does. Alacrity, speed of thought, they're muddled. I hear this complaint frequently, and oftentimes we look externally. Well, of course my brain's a little fogged. I'm stressed at work. My boyfriend's an idiot. I don't like my job. I don't like where I live. These variables are real. But remember, folks, the brain is an organ made up of cells, like your liver, like your kidney. So let's talk about what is brain fog and what can be done in the presence of it. Now, this is different from dementia or mild cognitive impairment. These are progressive decays in memory function, typically happening past the age of 50 or later. And that's a critical topic to discuss. We'll take up at some other juncture, but brain fog, this can happen at any point in life and can complicate other entities. The clarity of thought and speed of thought are impaired. Maybe word finding is a little bit impaired. I used to be really sharp. I could knock out numbers quickly. It's not happening like that. I never hesitated to find a word. I'm struggling to find the right noun to plug into a sentence. I'm having trouble with names. So let's start with some of the very basics. You got to take care of your brain. It needs some basic things. It needs to be taken for a walk. Your brain needs physical activity, folks, and it needs to be outside. I don't care what time of year it is. It needs 5 or 10 minutes of just sunshine and air. Now, sometimes I can go the whole day from my office to my car to my home and barely get outside. That's not good for the brain, so take it out for a walk. It needs to be fed and watered. When you get dehydrated, when your fluid is behind, one of the first places it shows up is in your brain. I'll know sometimes if I get more irritable that I need to have a little bit of water. Athletes know this. When their brain is not properly hydrated, their function can decline. So think about food, think about water, and think about the connection from the brain to the gut, the stomach. If your stomach is not right, your brain won't be right. There's a nervous system and there are hormones that connect these two organs very critically. And in the space of gastric inflammation, the brain can be impaired. Now that can happen even in the setting of chronic drug therapy. Things like proton pump inhibitors. It's a drug that I love to hate. Look, sometimes you have to have omeprazole, pantoprazole, Prilosec. There's a host of them. Without them, your life may be miserable, constant heartburn. But don't lean on the drugs, folks. Too much dependence on the drug can weaken your body's own gastrointestinal function. The stomach wants to have acid in it. The acid is important for proper gastric functioning. A heavy reliance on the proton pump inhibitors can impair the bacterial balance of the intestine and the rectum, thereby affecting the brain. So what to do if you're on the drugs and you can't come off them? You want to complement it with a high dose, high quality, broad spectrum vitamin that has all of the B vitamins in it and vitamin C. Now, when you're shopping for a multivitamin, folks, look for what's not there. It should have minimal, if any, calcium. Calcium's a bad player. Do not take it as a supplement. It serves no valuable purpose. It does not protect your bone, and it correlates with an increased risk of prostate cancer in men, maybe breast cancer in women, and certainly possible coronary artery disease, so no calcium. Maybe a minimal amount just to neutralize acidity. Another thing I like to not have in a multivitamin, copper. I get it, copper is essential, but remember, there are different kinds of coppers. There's a good one and a bad one. It's the simplest way to think about it. The good one you get from food. The bad one, those are in your copper pipes in your home. It's in the copper that they typically use in almost all supplements. Why? Because it's cheap. Why? Because you don't know the difference. It just says copper. You don't know what you're taking. Let's be honest. So where do I get my copper? I get it from cashews. Cashews are a high source, as is dark chocolate. So multivitamin, feed your brain. How about probiotic? I think probiotics are generally a little bit overutilized. Look, if you're eating a good diet, high in fiber, your gut's fine, you're pooping regularly, you don't overdo the alcohol, you're not putting anything in there that would muck it up. A probiotic is not an intrinsic essential need. But let's say that's not you. You're bloaty. Your gut doesn't feel right. Maybe you're on a proton pump inhibitor. Maybe you just got over an infection. You're placed on antibiotics. Antibiotics can disrupt the bacteria in your colon for up to 3 months. In that case, restoring the bacterial balance with a high quality probiotic. High quality. Do not expect this off the shelf from a big box store, or for that matter, most pharmacies. That's because these bacteria are alive. And when they get shipped, they start to die off. You want to get this from your healthcare provider ideally, or a high quality source where you can trust what's in it. These are hard to find. Most of your naturopathic doctors, chiropractors, and a lot of osteopathic and functional medicine doctors are plugged in. What are you looking for? If you're in a recovery phase after antibiotics, you want to have upwards of 100 billion units of bacteria in there. It's one of the few things that have shown to actually improve cognition in people with dementia. So you got to make sure the gut's healthy. We got to feed it, water it, take the brain out. What else can cause this? Post-infectious neuroinflammation. I'd say this is one of the more common triggers. It's sometimes ascribed to COVID or long COVID, right? And COVID is clearly a risk factor for brain fog. Post-COVID is a risk factor. But any infection can do this. Lyme disease, the flu, RSV, fill in the blank, pneumonia, a chest sinus infection. What happens? You end up with a post-infectious inflammatory environment, a cytokine overload, creating neuroinflammation. The way to neutralize that, I like a good cycle of nicotinamide adenine dinucleotide, NAD. Do not take NAD orally. It doesn't absorb. There are quality precursors. Nicotinamide riboside is one of them. You can get NAD as an injectable. You need to get that from your doctor. It's not something you can get off the shelf. And in many cases may not be necessary. The nicotinamide riboside can work quite well. I recommend a 2 to 3 month cycle of nicotinamide riboside at 300 to 500 milligrams per day. Or in our practice, we do subcutaneous injections twice a week for our patients. As a recovery tool for the young and the healthy, you do not need NAD every day for its anti-aging merit. You don't need it for its health-preserving value until you're at least past 40, maybe 50, because your body's making plenty of it. So we want to restore the brain post-infectious, reduce neuroinflammation. What other things can do that? Good antioxidants like vitamin C, like omega-3, a pure omega, is another difficult thing to buy high quality. There are some good sources you can get online. Nordic Naturals, Carlson's are two name brands that come to mind. Many functional doctors stock this in their office. It's reliable. Another thing you do not want to get from the big box stores, because it's fish oil, right? It means it can go rancid. And they put aromatics in it so you can't smell that. It's a fish oil. We keep ours refrigerated until it's dispensed. I recommend you keep it refrigerated at home as well. You're looking for EPA and DHA on the label. Those are the two components of the fish oil that are most valuable for brain health. And you're aspiring to get about 900 milligrams into you if possible. Of course, if you're taking salmon twice a week, you're probably good to go. So we've got the micronutrients, we've got the need to feed, water, nurture brain cells. We've got methylene blue. Now, methylene blue is used in this setting as a transient therapy, that is, for about 2 or 3 months. In my practice, we prescribe it from compounding pharmacies. Why? It's reliable. Why? It's safe. Why? Because we can trust what's in it. You buy it online, it's a roll of the dice. The nutraceutical and supplement manufacturers, not as highly scrutinized, regulated, and reliable as a good compounding pharmacist. I recommend 20 milligrams once a day for a 90-day cycle to restore brain, restore its acuity, sharpness, and function. What else makes the brain foggy? It's hormones, folks. It's hormones. Or I should say, it's a decline in the ideal hormone levels. I see this quite frequently. Young women in particular are very hormonally sensitive with regard to their brain function. Same thing for men, although it happens later. Women, when they're still menstruating and they're premenopausal, technically, start to, in some cases, experience cognitive impairment, dullness of mental function, increase in irritability and short-temperedness, sometimes mood disturbance. Often, this gets labeled as depression or anxiety, and they get put on drugs. That's a horrible idea. Unless you absolutely need an antidepressant drug because you cannot function, find a better remedy. The drugs can sometimes be life-changing and critical for your function. However, they can also amplify the brain fog, make you dull and tired, interfere with sexual function. So what do? We implement hormone therapy in the form of testosterone especially. Testosterone, yes, for women. The proper dose does not cause andronization, does not cause facial hair or acne or deepening voice. It does not do that. Women, you need testosterone. You have it already, just not enough of it as you get older. It's the first hormone to leave the building as you're entering in the perimenopausal window. Do not rely on a blood test. You cannot tell from a blood test where you are in that menopausal arc. If a woman goes to the gynecologist and says, I want you to test me for menopause, it's a waste of time. Your symptoms and your age dictate it. So where does that fall? By process of elimination, folks, you've got to address brain health and brain fog, right? Do the basics first. Make sure the gut is right. Feed and water the brain. Avoid drugs that can impair it. Beta blockers sometimes are utilized for blood pressure. They can be brain fogging. Antidepressants can be brain fogging. Proton pump inhibitors can impair cognitive acuity. So you've got to be thoughtful about the drugs you're on. Scrutinize them. Micronutrient insufficiency. Not enough B vitamin, not enough vitamin C. Those things can impair the brain and put a drag on it. Inflammation, we talked about that. That can put a drag on it. So as I'm processing this for my patients and we're addressing brain health, we get to the hormone piece. How do we know if your brain fog is coming from inadequate testosterone? The best way, after things have been analyzed and we've made sure there's no medical contributor and we've made sure there is no reversible basic function need, food, water, etc. In our practice, we do intravenous high-dose vitamins. Fabulous. If you can get to a high-quality infusion center, high quality. How do you know if it's a high quality? A little sidebar. Number one, the doctor or the nurse practitioner is on site. You go to the drip bar and say, I'd like to talk to the doctor. Oh, there's not a doctor here. Find another drip bar. Nurse practitioner is equally skilled in this, by the way, because you want to talk to them at least for a minute. In fact, that's a requirement in most states, certainly in Rhode Island where I am. Then a high-dose infusion is fantastic. It bypasses the gut, eliminates the absorptive issues, and can have an immediate charge effect on the brain. In fact, you put an NAD in there as well, and that can help. So the brain is still not hitting on all cylinders. A cycle of testosterone therapy is completely rational. safe to do, self-administered in most cases, either injectable or as an implantable pellet or as a topical cream. How it gets in you is less important than the proper dose and monitoring. You'll know right away, within a matter of a few months, maybe weeks even. The brain clarifies. Why? Testosterone is a neurotransmitter. It stimulates the speed of electrical impulse from one nerve to the next. Your brain does not work its best without it. Confidence gets weak. Speed of thought gets impaired. I've had men and women come to me starting to struggle in their job, which relied on a lot of good, high-quality brain function, have it all come back to them when they started some of their testosterone therapy. You should never accept a foggy brain. You should never accept it because of your age or your circumstance or the stress. Sleep is important as well. Sleep is important to restore the brain, but you can't do it with drugs. That'll fog it up even more. So sleep comes down to the basics. Controlling ambient light, get away from electronics, do all the good sleep hygiene stuff. And if all that's not working quite well enough, the cycle of peptide can be of some value. There is a peptide that I'll occasionally use called sermorelin, which is a growth hormone releasing peptide. Growth hormone correlates with restoration and oftentimes supportive of sleep. So that's a factor. Another factor for women more than men, we're back to hormones. If you're not sleeping well, oftentimes it's indicative of a low progesterone level relative to what your body needs. You can't tell the results of this based on the blood test. Your blood test can say, well, your progesterone's in the normal range. You know what we can't measure? Receptors. We can't measure testosterone receptors or progesterone receptors. You only can perceive their effect based on how you feel. Once again, a therapeutic trial is in order. This is called one way to assess whether or not that substance is going to help you. Sometimes the only way to know is to execute the trial and put it to work. Fresh brain, clear brain, fast brain, confident brain, stress-resilient brain are all your birthright, right? Of course you avoid stuff that hurts it. What hurts a brain? Alcohol. How much? It's interesting. It may be that a small amount of alcohol is good for the brain. We don't know. I know it's a heresy for a doctor to talk that way, but it's true. We know that small doses have never been shown to cause neurologic harm. And what's a small dose? My dad was a family doctor. He used to joke, the cutoff for drinking alcohol is anything less than your doctor drinks. In reality, 1 ounce is pretty safe for the majority of people. That's 1 ounce per day. No, you don't get to save them up and have 5 ounces on Friday night. It does not work that way. How about cannabis? It's damaging to the brain. Can we get over the fact or the perception that somehow this is a health enhancement? Cannabis, it's got its niche. You know, and I understand it can help some people. Pain, nausea, it can have some value. But as an intrinsic health support, I don't think so. As a possible neurocognitive fogger, yeah, it's totally possible. So cleaning up, making sure that you're eating well. By eating well, you guys know I'm not an advocate of fasting unless it's for religious purposes or philosophical pursuit. I prefer frequent small meals. Everybody's got to listen to their own body. I do have people who swear by it. They'll say, Doc, I eat once a day and I feel great. Okay, I'm not going to dispute your sense of internal wellness. But for the rest of us, that type of a fasting approach typically does not correlate with the best brain function. Brain likes to be fed. No, not simple carbohydrates, not junk food, real food. So brain fog, looking at the basic elements of it, and then more advanced, looking at hormone therapy, micronutrient support. Think about your vitamins. Think about vitamin D. Now, vitamin D is critical for brain function. In our world, we love to see people with blood levels above 50 but below 100, which is quite a bit higher than most conventional doctors would endorse, but it can be tested. Of course, methylene blue, testosterone, these are all attributes of pure omega, an omega-3 fatty acid, DHA and EPA, all go to the brain, and physical activity. Notice I didn't say exercise. Exercise is quite optional, but physical activity, literally walking, moving, all good for the brain. So take care of your brain. Look, I'm advocating for you to live to be 100. In my world, I want to make sure we take care of the brain first. And although it wasn't today's topic, remember to get the lead out. Lead damages brain, and go to my podcast on that topic. I'll be talking about it again in the future. Until then, keep your brain sharp. Keep watching this podcast so you can get all the information you need to avoid doing harm to yourself or having others do harm unto you. My colleagues in medicine sometimes are well-intentioned, but tend to be a little bit too confident in their procedural dynamics and their drug therapy dynamics, right? We're overdrugged and we're unhealthy. So let's stop being victims to the system as it is. Until next time, folks, wishing you 100 healthy years. I'll talk to you then.